Can PGS embryo diagnosis increase the success rates in IVF? So if you have two embryos, one that's been biopsied and is known to be genetically normal, and a second embryo that has the same morphological quality and is also, we can see from how it evolves, genetically normal, but it hasn't been biopsied, then these two embryos have the same chance of implanting. So that means that the embryo biopsy itself doesn't seem to increase the chances of an embryo implanting, but it also doesn't reduce the chances of an embryo implanting, and that's important to hold on to. But the important concept is whether the embryo looks normal under the microscope without biopsying it. Can you tell? And at the moment, when we look at an embryo under the microscope, we can't tell whether it's genetically normal or not. So we know that women who are under 35 have a high chance of producing genetically normal embryos. But we also know that as they get older, they make more genetically abnormal embryos. We also know that the ovarian stimulation itself can increase the number of genetically abnormal embryos. And we know that male factor infertility can profoundly affect the genetic quality of the embryos created. So PGS identifies the genetically normal embryo, and so in that way has been shown to change three things. It can decrease the number of embryo transfers that a woman needs to create an ongoing pregnancy. It can decrease the time that it takes that woman to achieve an ongoing healthy pregnancy, and it can also reduce the risk of miscarriage for that pregnancy. So to answer the question, can PGS embryo genetic diagnosis increase the IVF success rate? The answer is both yes and no, because for a woman, an individual woman who needs IVF, on her quest to have a baby, PGS can improve her chances of achieving a healthy pregnancy earlier, even if the actual biopsy itself doesn't increase the chances of an embryo implanting compared with one that hasn't been biopsied.